Good evening, everyone. Good evening, all. I'm audible and visible. So, welcome to FARRE series. This is Dr. Manjunath, your forensic medicine faculty, FMT guru. Today, we are going to discuss very important long essay, short answer from toxicology. As you know, toxicology that covers 25% of the total forensic medicine syllabus. Some commonly asked questions are management of snake bite, organophosphorus poisoning, cardiac poisons, plant organic irritants. Yes, I'm audible. Yes, Rakesh. Are you there, Rakesh and others? PMO, Rajesh, good evening, all. As you know, toxicology is the study of toxin, basically the fatal dosage, fatal period, clinical feature, investigations, management, and medical legal importance. One ideal poison is arsenic. The arsenic is known as king of all poison, which is ideal homicidal agent. Others are example thallium. Okay, thallium is the ideal homicidal agent. The king of all poison arsenic, the queen of all poison, that is aconite. The king of all kings, that is thallium. Yes, good evening, Dr. Firoz, Rakesh, Srimati, Shivakumar, Bhumika. That's great. Yeah. Fellow, let's start. In the beginning, as a part of Booth Bungalow series, here is a case of triple death. A real case, a real scenario. A case of unnatural death as per 194 BNSS, Bharatiya BNSS, Bharatiya Sakshya Adhiniyama, and BNS, Bharatiya Nyaya Samhita. 194 BNSS, triple murder in wet agricultural field. The question is it suicide or homicide or accidental? As you know, homicide, that is murder or culpable homicide not amounting to murder. This is the crime scene photo. Death of father, mother and the son. All three were farmers. They were found dead in agricultural field. All the three. During postmortem examination of the son, you can see here clearly visible entry wound of electrocution, also known as entry mark. And during examination of father and the mother, there were no signs of entry wound or exit wound. There are only signs of cyanosis, petechial hemorrhages and congestion. So the son that shows during postmortem examination, the son dead body shows entry wound. No injuries on the body of father and mother. The wet agricultural field. Unnatural death. Triple death. My question is it suicide or homicide or accident? Anyone? Anyone, can you guess? And this is again the picture. This is the crime scene photo we reconstructed. You can see here husband and wife, father and mother, and the son who is playing with some wooden stick with high tension wire above their head within the agricultural field. Can anyone tell me what is the probable manner of death in this case? So what is the finding here? Finding, you can see here, wooden stick, the sun, electric pole, wet field. Anyone? So the answer is the wooden stick. Rainy season, wooden stick, high tension wire above the head. So accidental electrocution of the sun, and because it was wet outfield, wet agricultural field, so the electric current directly passing from the sun to the surrounding area and to the father and the mother. So all the three died because of ventricular fibrillation. So cause of death is ventricular fibrillation. The manner of death is accidental. Once again, go back to this picture. In this picture, you can see here crater formation. Entry wound. The electric current enters the body, where this electric current is converted into mechanical energy. So the mechanical energy that causes shallow crater formation with the brownish discoloration. This is classical entry wound known as endogenous burn, also known as Joel burn. Yes, Menakdatta, very good. All answering, that's great. So with this introduction, let's start today's topic. One very commonly asked long essay in any university exam, probably from snake bite, usually from common cobra bite. Or sometimes question can be asked, name big four snakes, the fatal dosage, fatal period, the clinical features, signs and symptoms, investigations, and the management, do's and don'ts in case of snake bite, and the medico-legal importance. So classical 10 marks question, frequently asked in forensic medicine. Yes, good. Tanya Sharma and others, that's great. Everyone is answering, that's really nice. So Bhumika, what are the big four snakes in India? Can you answer? Big four means common snakes in India. One is common cobra, Naza, common crate, that is Bungaru ceruleus, Russell's viper, that is Dubai Russellii, saw-scaled viper, that is basically Achis carinatus. So there are four common snakes. The treatment is very common. The treatment is anti-snake venom. Yes. Let's see. Now look at this. All these are poisonous snakes. You can see here the four images. All are poisonous. You can also see the fatal dosage and the fatal period. Can anyone identify what is the snake? A, for example, this is A, B, C, and D. Anyone? In A, you can see the hood spectacle mark is there, a rounded pupil. The abdominal scales are large, covering entire breadth. That is a feature of poisonous snake. A rounded tail. So most of the poisonous snake, the tail is pointed, but in common cobra, it is basically round. So that is one. The second one, B. The B has transverse lines over the body. Very cunning snake. Cunning like Katappa in Bahubali. It has a tendency to bite people in their sleep. The clinical signs and symptoms resemble like stroke. Then we have white wavy line and the bird foot mark. Triangular head. Constricted neck. Broad belly. Pointed tail. And also you can see here brown markings are there. So can anyone try? Yes, so Bhumika is telling Russell's viper. Very good. So this is Russell's viper. RV. This is saw-scaled viper. This is common cobra. This is cobra. This is common crate. Common cobra, the fatal dosage 15 milligram. It acts on the neuromuscular junction. It inhibits the action of acetylcholine. It is postsynaptic. The fatal period 30 minutes to 6 hours. King cobra, which is larger than the common cobra, the fatal dose is 12 milligram. Spectacle mark is usually absent in king cobra. The scientific name is Ophiophagus hanna. That can be viva question. Then common crate, I said already, Bungaru ceruleus. The fatal dosage is 3 to 6 milligram. The fatal period is 18 hours. Most common in India. The black color snake, a short snake, very poisonous. The fang marks are totally invisible. The clinical features resemble like common cobra bite with very high paralysis, very less convulsions. So probably common crate. So stroke. Then triangular head viper. The vipers are hemotoxic. Local symptoms are maximum. Yes, many answered. That's great. Tanya Sharma, Menak Datta. That's really nice. Okay. Now, again, in exam, you need to write classification of snakes. Classified into Elapidae, Viperidae, Hydropidae. Elapidae means they are neurotoxic. Elapidae means neurotoxic. So what are neurotoxic snake? Common cobra, common krait, and your mamba and coral snake. They act on the neuromuscular junction. They inhibit the action of acetylcholine. The classical presentation is ptosis, respiratory paralysis, and death. Viperidae, they are basically hemotoxic. Increases clotting time, increases bleeding time. Hydropidae, they are basically myotoxic. They cause rhabdomyolysis, especially the involvement of the neck muscle, shoulder girdle muscle. There can be hematuria. There can be kidney failure as well. But death is very rare in case of Hydropidae. Example are sea snakes. Hydropidae, sea snakes. So this can be 3 marks question. Yes, fine. So try to memorize the most fatal venom is produced by common krait. Look at the fatal venom. 3 to 6 milligram can lead to death. The 3 milligram, it's very poisonous. 3 to 6. It acts on the presynaptic neuron. It inhibits the release of acetylcholine. It causes paralysis. So I'll write in the chat box. The krait is fatal. The krait bite is fatal. Write this along with me. Krait. Krait means katapa, very, very poisonous. Even small dosage can lead to death. It's very fatal. So krait is equal to fatal. Please write in the chat box. Krait is equal to katapa. Keep writing guys. Krait is equal to katapa. The katapa is a character in Bahubali movie. You must have seen Bahubali 1 and 2. A very famous character. Cunning character in that movie. So katapa, krait. So this is the classification of snakes. Elapidae, Viperidae, Hydropidae. Now comes his clinical features. In exam, please write clinical features. Like in neurotoxicity, you need to write broken neck sign, ptosis. There can be hypoxia, there can be hypercapnia, difficulty in speech, difficulty in speaking, difficulty in swallowing, there can be dysphagia, abnormally sleepy. Weakness of the muscle is a classical feature of common cobra, common krait bite. Need to highlight this. In viper bite, there will be local symptoms. There will be swelling, there will be vesications, there can be bleeding, there can be bilateral enlargement of the parotid gland, hematuria, acute renal failure, increased clotting time, increased bleeding time, disseminated intravascular coagulation. So there can be many findings. Okay, yes, clinical features. Then comes is the investigations. Investigation, enzyme immunoassay. You can also do clotting test 20 minutes, whole blood clotting test, and other investigative measures. The treatment is very simple: anti-snake venom. Okay. Now look at this. What are the indications for giving anti-venom? This can be 3 marks question. So indications are clinical indications, or it can be lab investigation. Clinical: spontaneous systemic bleeding. Why is there systemic bleeding? Because of the decreased clotting factor, because of high usage of the clotting factors, that leads to depletion of the storage of the clotting factors. There can be spontaneous bleeding. Ptosis and ophthalmoplegia and paresis, eye muscle involvement, one of the earliest feature. This can be viva question. Hypotension, shock and arrhythmia, very common in case of viper bite. Oliguria, hematuria, very common in viper bite. Local swelling involving more than half of the bitten limb within 48 hours. That is a feature of viper bite. Okay. Or abnormal 20 minutes whole blood clotting test, abnormal ECG, rising creatinine, dipstick positive for the hematuria. All these are indications in case of snake bite. The treatment is ASV. One of the common complication is anaphylaxis. This is because it is of equine origin, horse origin. Anaphylaxis is very common. We need to treat symptomatically in case of anaphylaxis. The dosage is same in adults as well as in children. No test dose required. Then how the clinical presentation is classified? It is classified into mild, moderate and severe. So mild means local swelling, purpura and ecchymosis. The antivenom required is around 5 vials. If mild systemic symptoms are there, coagulopathy is there, bradycardia is there, around 10 vials required. Rapid progression of systemic features, DIC, encephalopathy, paralysis and all, around 15 vials. Along with the ASV, neostigmine is given in case of common cobra bite. Okay. So then comes is, what is the right approach? 3 marks question. 3 marks question. Snake bite is equal to, please write, snake bite is equal to right approach. RIGHT, right approach. Viva question. What is right approach? R means reassurance. One of the commonest cause of death in case of snake bite is fear. Fear leads to death, cardiac arrest and death. Increases cardiac output, it leads to cardiac arrest and death. That's why reassurance is very important. R for reassurance. You need to reassure the patient. Don't worry, we are there to help you. We are going to give you some anti-snake venom. You will be normal. So that is how you should reassure. Second thing, immobilization. The mobilization can lead to more and more blood circulation, more and more entry of venom into the heart and the brain. So immobilization is required, but immobilization should be appropriate. The pressure must be less than diastolic blood pressure. It must be 50 to 60 millimeter of mercury, not more than 80. That can lead to gangrene and death. Get to the hospital immediately, GH. Tell the doctor about the emergence of symptoms like ptosis, weakness, abnormally sleepy and all. So this is the right approach. Please write in the chat box. What are don'ts? Don't do a tight tourniquet. Don't apply tight luggage haul. That can lead to gangrene and it can lead to amputation of the limb or loss of the limb. Incision suction is not required. The washing of wound is very important in rabies, but not in case of snake bite, because prolonged washing can increase the entry of venom into the deeper tissues, the deeper veins. From the deeper veins, it can enter into the vital organs. Electrotherapy, cryotherapy, application of electric current, cold ice packs, it is not very effective. Don't do that. Okay. So all these are do's and don'ts in the snake bite. Good, 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 many good. Menak Datta, excellent. Tanya Sharma, excellent answer. Srimati Shivakumar, beta, excellent answer, excellent. Rajesh, yes, Rajesh, are you there? Okay. Veshaki, Bhumika, yeah, yes, good. Chal. Okay. Now look at this. So there are four images are there. Try to memorize. The first image is hematuria. The hematuria, kidney failure, is a feature of viper bite. MCQ. Bilateral parotid enlargement is a feature of viper bite. Vesication is a feature of viper bite. You can see the local symptoms. The local symptoms are a maximum in case of viper bite. You can make out here this image. You can see the extravasation of blood, extensive vesications, blisters are there, skin slippage is there, swelling is there, also sometimes the features of gangrene. All these local symptoms are maximum in Russell viper and saw-scaled viper because they are hemotoxic. They produce very high or very concentrated venom of enzymes like hyaluronidase and other enzymes. These enzymes causes cellular death. They cause cellulitis. This can be MCQ. Good, good. That's okay. Now look at this. Can anyone tell me what is the don't in this case? What is the don't that is done in this case? Or what is this actually the complication? Anyone can identify? Look at this. This is a clear mark is there. You can see the bite mark here. So this shows this application of very tight tourniquet. That is not acceptable as per the standard guidelines because it can lead to one gangrene formation, gangrene of the limb, point number one. So tight tourniquet, tight ligature can lead to gangrene, point number one. When you open the ligature in emergency suddenly, there will be sudden rush of venom into the vital organs that can lead to sudden death of the individual. That's why don't open all the ligatures suddenly. You can open one by one after starting ASV treatment. This is what you need to remember in your exam. Good, high pressure, that's great. Now look at this. This is a right approach, this is wrong approach. Okay, this is wrong approach, very wrong. So what you can see here, multiple tourniquet. This patient, 1, 2, 3, 4, 5, 6, 7. This is wrong. Look at this. This is very simple Sutherland wrapping. The Sutherland wrapping can occlude superficial veins. So that is more than sufficient to prevent the entry of venom from superficial vessel to deep vessels. So this is acceptable. We call it as Sutherland wrapping. This is not acceptable, that is tight tourniquet. What are two complications I said? One is the gangrene. Second thing, the sudden opening of the ligature in casualty can lead to sudden death of the individual. Yes. Okay, that's great. So this is the antivenom. You can just try to memorize. This is the antivenom, the life-saving drug in case of snake bite. Snake venom antiserum, polyvalent, that means it protects the multiple snakes. Enzyme refined, equine, that means horse origin. So it can protect the 4 snakes. What are they? Common cobra, that is the Indian cobra, and common crate, Russell's viper, and sask-tailed viper. The most common complication is anaphylaxis. So this is you need to write. Yes, guys, is it clear? Any doubt in this? For main question, you need to write all these points and also try to memorize MLI, medico-legal importance. Okay, I discussed in previous class, in any question in forensic medicine, you need to write the medico-legal importance. Like snake bite can be suicide. Rarely suicide. Like example, Cleopatra, suicide. Cleopatra. Homicide, murder. The murder by throwing snake into the bed of the victim. Homicide. Like example, Uttara murder case in Kerala. A proven case. Are rarely, are very commonly, remember, it is accidental. Accidental snake bite is the most common manner, not the suicide, not the homicide. Okay. Yes, Edushin. Any doubt in this, guys? Say yes or no. I'll just repeat everything. In exam, you write big 4 snakes. हो गया. के बाद लिखना है fatal dosage लिखना है, fatal period लिखना है, and the classification of snakes मतलब Elapidae, Viperidae, Hydropidae लिखना है. के बाद clinical features. कोबरा में क्या क्लिनिकल फीचर्स है, कॉमन क्रेट में क्या क्लिनिकल फीचर्स है, वाइपर में क्या है, एंड इन्वेस्टिगेशंस के बाद द मैनेजमेंट मतलब राइट अप्रोच. इसके बाद एएसवी लिखना है, एएसवी एंड नंबर ऑफ स्नेक्स प्रोटेक्टेड बाय द एएसवी, कॉमन साइड इफेक्ट, माइल्ड मॉडरेट एंड सीवियर, देन दिस इज सफिशिएंट एंड आल्सो मेडिको लीगल इंपॉर्टेंस. तो सुसाइड हो सकता है, होमिसाइड हो सकता है, एक्सीडेंटल. क्लियोपात्रा डाइड ड्यू टू सुसाइड. तो उत्तरा मर्डर केस होमिसाइड, मोस्ट कॉमन मैनर एक्सीडेंटल. ठीक है, इज इट क्लियर? यस, मेनक दत्ता, एक्सीलेंट आंसर. दैट्स ग्रेट. This is the newspaper headline. Kerala snake bite murder. Okay, murder. Husband sentenced to life for Uttara's killing. Punishable under 103 BNS. I said already, Cleopatra died due to suicidal snake bite. Now, just a revision. You just tell me what is this snake. Just identify, just revision of the snakes and related facts. Just 10 seconds for each question. Some image-based questions related to snake bite. Look at this. This has a hood. Spectacle mark is there. So rounded pupil. So also you can see the belly scales are large. So they are like this. Large belly scales. Head scales also somewhat large. Hood is there. Spectacle mark is there. So this is your Naja. Simple question. Naja can be 3 marks question. Clinical feature. Clinical features of common cobra bite. तो लिखना पड़ेगा टोसिस है, ऑप्थल्मोप्लीजिया, कन्वल्शंस, पैरालिसिस, रेस्पिरेटरी पैरालिसिस एंड डेथ. ठीक है, हो गया. कॉमन कोबरा बहुत बढ़िया. मेनक दत्ता, तान्या शर्मा, दैट्स ग्रेट. So the next question, look at this. When you see the transverse lines are there, steel black in color, very poisonous, this must be your Bungarus ceruleus. Bungarus ceruleus मतलब कॉमन क्रेट है. द कॉमन क्रेट बाइट रिसेंबल लाइक स्ट्रोक, याद रखना पड़ेगा, एंड ए प्रीसिनाप्टिक है. तो पोसिनाप्टिक कॉमन कोबरा है, प्रीसिनाप्टिक है, दैट इज कॉमन क्रेट है. याद रखना पड़ेगा. वेरी डेंजरस है, वेरी फेटल है, वेरी कनिंग है. डेथ अकर्स इन 2 to 6 hours ड्यू टू रेस्पिरेटरी पैरालिसिस. वेरी कॉमन इन इंडिया. बहुत ही कॉमन है. यस, दिस इज कॉमन क्रेट. वेरी गुड. Now look at this. This is a very interesting snake which has a pointed tail, triangular head, constricted neck, broad body, and brown spots are there. When you see the brown spots, याद रखना brown spots है, triangular head है, रसेल्स वाइपर लिखना पड़ेगा. एग्जाम में क्या है? रसल वाइपर. ठीक है. So identification of species also important. Sometimes, so the patient might bring snake along with the along with the presentation of clinical features. You need to identify whether it is poisonous, non-poisonous, whether it is comes under ASV or not. If it is very rare breed, then there will be death even after giving ASV. Okay. So this is Russell's viper. Everyone is answering. That's great. Now look at this. So this is one more very aggressive snake. You can see the bird foot mark. Bird foot mark. White wavy line is there. याद रखना white wavy line है, bird foot mark है, aggressive है, triangular head है, constricted neck है. इसका मतलब है, आंसर है Achis carinatus. So this is Achis carinatus, classical of saw-scaled viper. Saw-scaled viper. Very good. Manak Datta, Rakesh, very good answer. Now, what is this? Can I identify this snake? So this snake or sharp having black bands are there, yellow bands are there. It doesn't come under polyvalent bandy snake. Again, it is one of the common snake in India. So what is this actually? Bands are there. Clinical features similar to common crate. So this is banded crate. Banded crate. Again, crate I said. Crate मतलब neurotoxic है. ठीक है? Crate. ठीक है. Now this is one more very commonly asked question, guys. Look at this. This is very big. Bada snake. And it produces a very high amount of venom. Can lead to death of the elephant in few minutes. And wood is there. And spectacle mark is not there. It's big. What is this actually? So this is your Ophiophagus hanna. Ophiophagus hanna. याद रखना पड़ेगा. Ophiophagus hanna, king cobra. Scientific name. So fatal dosage around 15 milligram. So 12 to 15 milligram. Again, it is neurotoxic. Now look at the pupil. Sometimes the question can be asked in exam. Difference between poisonous snake and non-poisonous snake. So poisonous snakes, they have some classical features like triangular head. Hood is there. Poisonous snake. Pupil also. Look at the pupil. When you see the pupil, when pupil is like a slit, poisonous snake. Again, there are variations again. Pit is there. Pit viper. This is pit viper. Green pit viper. Most of the poisonous snake belly scales are large. Head scales are small. Again, there are exceptions are there. Pointed tail usually poisonous. Nocturnal habit है poisonous snake. Day habit है usually non-poisonous. The differences 5 marks question. After the class, go through that. Good. That's it. Now this is very interesting picture, guys. Can anyone make out what is the picture here suggestive of? What is this picture suggestive of? So this is the third supralabial. The third supralabial touches the eye. So this is eye. This is nostril. So third supralabial touches the eye, touches the nostril. What is the probable answer? What is this snake? Again, this is neat PG question. It can be MCQ in your exam. Anyone? So this is your common cobra. Common cobra, third supralabial is large. In common crate, the fourth infralabel is large. Okay. Fourth infralabel large in common crate and third supralabel large in common cobra. कॉमन कोबरा में थर्ड सुप्रालेबियल है ना वो लार्ज है. कॉमन क्रेट में फोर्थ इंफ्रा मतलब द डाउन, दैट इज द इंफीरियर सरफेस. द फोर्थ इंफ्रालेबियल इज लार्जेस्ट. याद रखना पड़ेगा. ओके, यस, दैट्स ओके, फाइन. नाउ लुक एट दिस पिक्चर एंड आइडेंटिफाई व्हाट आर दीज टू इमेजेस. So both are accidental cases, okay, very common in India. In the A, the patient presents with the ptosis, weakness of the eye muscle, weakness of the jaw muscle, facial muscle, abnormally sleepy, convulsions hai, paralysis hai. So history of snake bite in last 2 hours. A क्या है? B क्या होता है? B में क्या है? Vesications है, bleeding है. So क्या हो सकता है? ये याद रखना पड़ेगा. ये है न्यूरोटॉक्सिक है. न्यूरोटॉक्सिक. बी क्या है बताओ? बी है हीमोटॉक्सिक. मतलब symptoms, signs and symptoms of involving the blood vessel very common. So this venom is there, no, hemotoxic venom that acts on the basement membrane of the blood vessel. So when the basement membrane is affected, that causes increased permeability. That leads to severe complications. Accumulates the clotting system. So clotting, then there will be DIC and death. Yes, vesicles are there. That's okay. That's great. Okay. Now second question. The 5 marks question commonly asked in the exam. Difference between cobra bite and viper bite. What are differences? 5 marks question. I'm going to share the notes with you. So there are many symptoms are there. Like example, 16 symptoms are there. Go through these simple lines. Alapidae, what are the clinical features? Viperidae, what are the clinical features? Local reaction, gangrene, intoxication, gait, speech, paralysis, saliva, the pupil, aspiration. All this we can write in the exam. This I'm going to share with you after the class. Just revise once. Difference between common cobra and the viper bite. Yes, good. So Menak Datta and others all are answering. That's really nice. The next common question, very commonly asked in the exam, the classify OP compounds. Explain signs and symptoms in OP poisoning and treatment. बार बार पूछते एग्जाम में. लॉन्ग एसे, यूजुअली लॉन्ग एसे है. शॉर्ट एसे, वाइवा क्वेश्चन, short answer also. OP poison, organophosphorus poison. It is not opium poison, organophosphorus poison. Classify OP compounds. Alkyl phosphates, aryl phosphates. Example, fatal dosage. Signs and symptom. Before that, you can write mechanism of action. Scourge MTF is mnemonic. And the treatment. ABCD, gastric levers, atropine, oxymes, diazepam, intermediate syndrome, everything you can write in the exam, and also medical legal importance. So this is 10 marks question. 10 mark. Good. So Tanya Sharma is telling, sir, they are classified into alkyl phosphates. So organophosphates are basically insecticide. They're usually insecticide, herbicide, anti-helminthing. Even naru gases also consist of organophosphorus compound. So it's one of the common method of suicide, especially in farmers. Alkyl phosphates, मेलाथियान है, इसमें आता है OMP आता है, TPP आता है और HCTP आता है. फेटल डोसेज याद रखना पड़ेगा 1 ग्राम इन मेलाथियान. OMPA 175, TEP 100, HTP 350 है. So in case of OMPA, 1 drop can lead to death. All of the right? OMPA is equal to 1 drop. Khatam. 1 drop OMPA, life over. Life khatam. All of you write in the chat box. OMPA is equal to 1 drop. याद रखना पड़ेगा. Keep writing. Tanya Sharma, Yadushreen, Manak Datta, great answer. Rakesh, are you there? Please. Yeah. All these are alkyl phosphates. Then aryl phosphates, methyl parathione, metacid बोलते हैं. पैराथियन फॉलिडॉल, कॉमन नेम फॉलिडॉल है. डायजिनॉन कॉमन नेम है टिक20 है. Peroxone, all these are basically aryl phosphates. They have aryl group, that's why they are aryl phosphates. If they have alkyl group, they are known as alkyl phosphates. So they are basically organophosphorus compounds. Mechanism of action. What is the mechanism of action? तो mechanism याद रखना पड़ेगा. They inhibit acetylcholine esterase. Acetylcholine esterase. When acetylcholine esterase is affected, when it is inhibited, there will be high levels of acetylcholine. Okay, acetylcholine esterase acts on the acetylcholine. Acetylcholine is broken into or hydrolyzed into acetate and choline. So this is inhibited. It leads to increased ACH. As you know, ACH is a very important neurotransmitter of parasympathetic system. It acts on the parasympathetic system. There will be signs and symptoms of overactivity of parasympathetic system, like increased secretion, increased salivation, lacrimal gland secretion, diarrhea, salivation, urination and all. So all signs and symptoms because of overactivity of parasympathetic system. Treatment is parasympatholytic drug, that is basically atropine. याद रखना पड़ेगा. And again, acetylcholine esterase दो टाइप की है. एक होता है pseudocholine esterase. याद रखना पड़ेगा. Pseudocholine esterase present in the plasma. True choline esterase present in the RBC. This can be viva question. Pseudocholine esterase are the okay. Now to get distinction mark in exam, you need to write like this. So this is the very good answer. You need to write like this. Acetylcholine, pseudocholine esterase. Where pseudocholine esterase present? Liver, intestine, heart, white matter, also in the serum. True choline esterase present in the RBC, nervous tissue, not in the serum. So this actually leads to signs and symptoms. Okay, this is very important point you need to write to get distinction. Then comes his clinical features. The clinical features like this: slurge MTF. Yes, मतलब salivation. तो saliva secretion ज़्यादा होता है. Seizures होंगे, epilepsy होंगे, क्योंकि because of acetylcholine acts on the CNS. Sweating, sweating because of the stimulation of sweat glands. Sweat glands are supplied by acetylcholine. They are supplied by sympathetic system, but the neurotransmitter is acetylcholine. That's why. This is again viva question, tricky question. Why sweating in case of OP poison? Your answer must be, sir, in sweat glands, the neurotransmitter is acetylcholine that stimulates and causes sweating. Lacrimation, parotid gland, submandibular gland, increased lacrimation, increased secretion, M3 receptors. Urination, because of the relaxation of the sphincters, contraction of the detrusor muscle. Diarrhea because of the increased peristalsis. Gastric upset because of the increased HCl secretion. Vomiting can be seen. Emesis. Meiosis, very important feature. Meiosis, याद रखना पड़ेगा. Meiosis है. Midriasis in case of datura poison. Meiosis in case of OP poison. Pinpoint people. Meiosis can be seen in carbolic acid poison, opium poison, OP poison, many cases. Tachycardia. So there can be bradycardia as well. In the beginning there can be tachycardia. Later there can be bradycardia. This can be MCQ. Fasciculation. So the mnemonic is slurge MTF. Keep writing, guys. Slurge MTF. Lico, guys. Clutch. M. T. Yeah. Keep writing. Menak Datta and others. Then now comes this investigation. What are the investigations done? So in any a question, you need to write investigations. Investigations and management. And also you need to write the MLI. MLI लिखना पड़ेगा. Investigation, the levels of cholinesterase. The levels of acetylcholinesterase enzyme. So depends on the acetylcholinesterase level, they are classified into mild, moderate and severe. Either it can be RBC cholinesterase or plasma cholinesterase. Commonly done is plasma cholinesterase. But most accurate is RBC cholinesterase. And other investigation also you can do. Then management. The management basically gastric levels, ABCD, atropine and all. So in exam, to get more mark, you need to write this table. This one. This is very, very important. Yes, okay, view of my world, you don't worry. Don't worry. चलो, जनरल है एयरवे. सबसे पहले क्या करना है? एयरवे. एयरवे मस्ट बी क्लियर, मतलब सेक्रेशन एंड ऑल मस्ट बी क्लियर्ड ऑफ. Breathing should be maintained. Circulation okay. Remove the patient from the site of exposure. Very, very important. Wash skin with the soap and water. If ingested, perform gastric lavage and also give oral activated charcoal. So gastric lavage can be done in case of OP poison. Life saving. The gastric lavage done in left lateral position by using Eval's tube, Rein's tube and all. Gastric lavage indication, contraindication can be a 5 marks question. Activated charcoal is a physical antidote. It binds to the pores of the stomach. It prevents the absorption. Physical antidote. Then the drug of choice is atropine. The dosage is 2 to 4 milligram IV. Review after 5 minutes. Look for the signs of atropinization. If signs of atropinization present, maintenance dosage of 10 to 20% over 1 hour IV infusion. No signs of atropinization, like example, dry secretion, dry mouth, or clear chest. Then repeat the IV bolus with a double dosage. Again looks for the signs of atropinization. Then we can start prolidoxime, which is a cholinesterase reactivator, which is contraindicated in case of carbamate poison. Initial dosage 30 mg per kg body weight over 20 minutes. Maintenance dosage is 9 mg per kg body weight per hour. So this is distinction table. If you write this table in exam, you will get distinction mark in toxicology. Very nice table. Everything in one slide. Okay. Now again, Viva question can be asked. Muscle weakness reversed by. The muscle weakness reversed by prolidoxime or diacetyl monoxime, not by the atropine. Atropine is an antagonist. Atropine does not reverse muscle weakness. The muscle weakness reversed by prolidoxime or diacetyl monoxime. Important MCQ. And one more point, a question very commonly asked. So these oximes are given within 48 hours. Within 48 hours. Okay? Yes, within 48 hours. Because after 48 hours, there will be aging of the acetylcholinesterase. So when you give this prolidoxime, instead of decreasing symptoms, there can be aggravation of symptoms. And in exam, you can write one more very important point, intermediate syndrome. I'll have to write in the chat box, intermediate syndrome. Just write this word. Write this word, That is more than sufficient. After the class, go through what is intermediate syndrome, what are the clinical features, what is the mechanism, what is the treatment. Intermediate syndrome is a very important complication of OP poison, one of the most common cause for mortality and morbidity. Okay? The cause of death in case of OP poison is respiratory failure, respiratory paralysis. And clinical features, I said already, postmortem examination. So there will be signs of CPC, congestion, petechial hemorrhages, cerebral edema, cyanosis, congestion of most of the organs. So there can be kerosene-like smell. Okay. And FSL usually comes positive in case of OP poison. You need to preserve all the stomach contents, duodenum and its contents, liver, along with the gallbladder, and also the blood and the urine for the confirmation of the poisoning. Okay, so I hope you understood this OP poison. ठीक है ना, इंटरमीडिएट सिंड्रोम मैंने आंसर्ड. ओके, श्रीमती शिवकुमार इंटरमीडिएट सिंड्रोम, बहुत बढ़िया. यदुश्री बेटा ग्रेट. राकेश great beta, great. You are a distinction student. You will definitely get distinction in forensic, I'm sure. Okay? Revise, 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 revise. Tanya Sharma, बहुत बढ़िया. Bhumika is very consistent in all the classes. Hats up to you, Bhumika. Manak Datta, after a long time, Manak Datta, our regular student of live batch. Okay, very humble student. Great. Srimati Shivkumar, great. Hello. So, just to revise, OP poison याद रखना. OP poison in exam write alkyl phosphate, aryl phosphate. के बाद mechanism लिखना है. बाद में clinical features. The clinical features sludge MTF. Then comes investigation. Management में लिखना है 3 drugs: atropine, oxames and diazepam. Gastric levers, activated charcoal. Medico-legal importance. Then the postmortem findings. One more point to remember, there can be red color tears. Red tears. Red tears matlab chromodacruria. Chromodacruria. Write this in chat box. Red tears matlab chromodacruria because of the presence of porphyrins. So one of the rare finding in case of OP poison. Yes, keep writing, keep answering. Chromodacruria. That's great. Now look at this. So this is a case of OP poison. Okay, OP poison. Medical legal importance. Okay. Next comes is the cardiac poisons. So cardiac poison. Name cardiac poisons. Cardiac poison act on the heart. They act on the sodium-potassium pump. You know, potassium pump is very important. It maintains the cardiac action potential. Then is pump affected. There can be bradyarrhythmia, heart block and death. Now, can anyone tell me, in this picture, you can see, I know, there's a picture, right? What is the meaning of this picture along with this cardiac poison? Anyone? Why this picture in cardiac poison? Is there a relation between cardiac poison and this? Anyone? Can anyone tell me? Tanya Sharma. See, cardiac poison, especially the aconite. This aconite is very sweet poison. Sweet hai. So this sweet poison can be mixed with the any food like milk, curd, or sometime Mita Jahar. Yes, very good. Pan. Manak Datta, very good. It also can be mixed with the pan. This is pan basically. Pan, sweet in poison, so leads to death. Cardiac features, it resembles like MI. लोग सोचते हैं cardiac attack or cardiac arrest, heart attack, but it is not cardiac arrest. It probably a case of murder as per 103 BNS. Aconite is sweet poison, Mita Jahar. Okay, and classical feature is hippus. याद रखना पड़ेगा hippus. Hippus is a feature of aconite poison, classical alternating constriction dilation of the pupil. It acts on the cardiac action potential. It affects the sodium potassium ATPase pump and also the calcium pump as well. So it leads to death. So the treatment is basically digoxin. Treatment is symptomatic. What are cardiac poisons? Remember, all are cardiac poisons. Aconite. Aconite is the queen of all poison. Queen. Who is the king? The king is arsenic. The king is arsenic. The queen is aconite. Very interesting. The clinical features: salivation, abdominal pain. There can be features of GIT, and also there can be sweating. There can be involvement of the heart, resemble like heart attack. So aconite root resemble like a horseradish root. Yes. Then nicotine. So nicotine is the most common cardiac poison. If they ask you an exam, most common cardiac poison, your answer must be nicotine. Nicotine tabacum. Digitalis, also known as fox glow, quinine, Nerium odorum cerebra tivitia. So Nerium odorum cerebra tivitia is nothing but your oleander poison. Try to memorize this song. The song of oleander. The song of oleander is Nerium odorum cerebra tivitia. Like this we can make song. It's easy. Okay. Miriam odorum cerebra tivitia. Are we okay? Manak Datta, Edu Sain. Are we happy with my song? Is it irritating? Is it okay? Yes, come on guys. Then comes is cerebra odolum. Cerebra odolum means green mango. Mango is very good for health, but green mango very bad. The green mango is a cardiac poison. It consists of cerebra odolum. This is very common in Kerala, Tamil Nadu. It looks like a mango. One mango can lead to death. So especially in people suffering from suicidal tendencies or accidental death in children. One kernel leads to death. And one more Cleanthus cholinus is also cardiac poison. So if you remember the name, that is more than sufficient. Yedusine. Okay, Managutta is telling. Okay. Just to try to memorize my song, guys. The song of oleander. Nerium odorum cerebra tivitia. हो गया बहुत बढ़िया आगे देखते हैं हाँ now look at this now I am totally confused. What are these two images? A and B. A क्या है B क्या है बताओ जल्दी बताओ. You must be fast. Okay, Josh must be very high in forensic class. Very high. Okay. Look at this now. What is this yellow color flower? Which is yellow oleander. Yellow oleander. The pink oleander. So the one is the pink oleander. Very common plant. Pink oleander and yellow oleander. Okay. Next. Now look at this. Oh, very nice picture, guys. Look at this mango. Can anyone identify what is this mango? Suicidal mango tree. Suicidal mango. Mango is good, but this is mango. Cerebra odolum. Cerebra odolum is very bad. Okay. Yes, Dr. Basit. That's great. बहुत बढ़िया. Name 4 plant organic irritants in 5 marks question. Plant organic irritant. So whenever question asked, Try to memorize organic irritant. One is your castor, no doubt. Scientific name is Ricinus communis, ricin plant. This is very poisonous agent of bioterrorism. It inhibits RNA polymerase, inhibits protein synthesis, causes cellular death in 3 to 4 days. 10 seeds can lead to death. 10 seeds. हो गया castor plant. Second है Abrus precatorius. Abrus मतलब रति, manmata, abrus. The color of the seeds, red and black color, very attractive color like rati and manmata. So abrus is a cattle poison. It is used in the formation of suey needle to kill animals, cattle, for the purpose of animal skin. Abrus precatorius. It is also arrow poison also. It can be used in homicide, very rarely, suicide also, accidental poisoning in children. The third is your marking nut. Marking nut is Semicarpus anacardium, SA. Semicarpus anacardium. The scientific name is, a scientific principle, active principle is semicarpal bilavanol. Marking nut used by the laundry people to put mark on the clothes. Marking nut हो गया third. Fourth है, can anyone tell me fourth? Calotropis. Calotropis procera, Calotropis gigantea. If pink color flower, gigantea. If it is white color flower, it is basically procera. हो गया. Again, it is used in artificial bruise, criminal abortion, many conditions. Calotropis. This can be MCQ as well. Then comes is your chili seeds, capsicum annum. Capsicum annum. It leads to human hand, it leads to dermatitis. So there are many. One more you can write in exam, protein also. Protein seeds, Protantiglium. Can also explain about the signs and symptoms. Signs and symptoms are overlapping. So there will be GI symptom, there can be bleeding into the major organs, like example, brain hemorrhages and all. Very famous case is umbrella murder case. Good. Okay. Well, if you keep writing, umbrella murder case. After the class, go through this. Umbrella murder. Umbrella murder is equal to resin. याद रखना पड़ेगा. Umbrella murder. Umbrella was used. Umbrella was used. Along with that, a pellet of the resin was inserted into the body. It was neglected by the victim. Died after 4 days due to multiple hemorrhages. A classical, well-planned murder. Umbrella murder. Just write umbrella murder. So, it's very interesting case. Abrus I said rati, marking nut I said, calotropis I said, chili seeds, scrotin. So there are 6 organic irritants. Sometime now look at this plant. This is one of my favorite question in Viva. Favorite plant kept in the exam. Look at this. Most of them are in clusters. Clusters में है. And spiny projections भी है. Resin is the content है. Very common plant in the waste areas, wastelands. It's a waste plant. And from this waste plant, castor oil is prepared. Castor oil. Castor oil is non-poisonous. So this is castor plant. Remember, castor is equal to cluster. Castor is equal to cluster. Cluster is equal to castor oil. Oil is not poisonous, but the content of the seeds, very poisonous. The seeds are very shiny, which have brown and black markings usually. Yes, Sahil Mullah, I am good. Sahil Mullah, how are you? How are you, Sahil Mullah? Now look at the seeds. The seeds are black and red in color. Very, very attractive seeds are there. Like a Rati Manmatha. Identify this. Identify, guys. Identify. Come on, guys. Come on. Come on, guys. Come on. Try. What is this? Castor ho gaya. Menak Dutta. Tanya Sharma. What is this image? Image showing very, very attractive. Used as a cattle poison. Used in the preparation of sui needle. Is also used in weighing the gold also. So I think 12 seeds is equal to 12 gram, like that. So this is abrus. ये है abrus. 3 marks question. Abrus means it's organic irritant. Abralinic acid. Abrane is the active principle. Medical legal importance. It can be used in suicide, accidental poisoning in children, rarely homicide. It is used in arrow poison, also used in case of sui needle to kill animals. You can write few points in exam. 3 marks question. बहुत बढ़िया. Now look at this. What is this A and B? याद रखना. Just look at this. Heart shaped seeds. Heart shape है. Projection है. फ्रेंड आपको प्रोजेक्शन है, हार्ट शेप्ड है, ब्राउन अप ब्लैक है. इसमें देखो ये पिंक कलर है, पिंक एंड वाइट मिक्स है. So both are organic irritant. Now this is a very common plant. You must be knowing. What is this? So this is your marking nut. Marking nut याद रखना. 3 marks question. Marking nut used in abortion, artificial bruise. And this is calotropis. हो गया. Next question. Good. Many answered. That's correct. Next question. Medico-legal classification of poisons. 5 marks question. 5 mark. Medico-legal classification, not the medical classification. Sometimes question can be asked about classification of antidotes. Physical antidote, physiological antidote, chemical antidote, pharmacological antidote, universal antidote. You can write many points. Okay, medico-legal in exam you need to write like this. Homicide. Homicide means murder. To kill people. What are the poisons used? Arsenic hoga, aconate. Arsenic is ideal homicidal, which causes rice water stool. Colorless, tasteless compound, which can be mixed with any food and drink. Arsenic, one of the oldest poison in the history, especially arsenic trioxide. So याद रखना पड़ेगा. This is very, very important question. Homicide हो गया. Suicide, opium, morphine, heroin, barbiturates, organophosphates. Accidental, many poisons, even OP poison, accidental poison, depends on the manner. Then cattle poison, abrus, arsenic, aconite, nitrate, calotropis, oleander. Abortifacient used in criminal abortion, calotropis, croton, aconite, ergot and all. Stupefying, datura, cannabis, chloral hydrate. Datura leads to 90 manifestation. Cannabis is nothing but ganja. Chlorohydrate is dry wine. Rare poison, like example insulin poison. Domestic poison, like example nail polish. Baby powder, that is boric acid, that leads to boiled lobster syndrome. Rat poison, aluminum phosphate, zinc phosphate. Watermelon case we discussed in last class. Disinfectant, basically phenol. Garden poison used in the garden. Insecticide like DDT, fungicide, weed killer. Therapeutic poison, antiseptic, furniture polish, and some throat tablets as well. Kitchen, like baking powder. Mastic basically consists of red phosphate, which is non-poisonous, and all. So, okay, this is the medico-legal classification of poison. Yes, so this is okay. Fine. So this completes some important questions in today's lecture. In one more lecture, we are going to complete heavy metal actually. Heavy metal in next class. Arsenic, lead poison, copper poison, briefly. Okay. So along with some more miscellaneous topics, gastric lavers. So this completes today's lecture. Now I have some 3 marks question. So look at these 3 marks questions as a image based question. Let's discuss these 3 marks question frequently asked in the exam in a manner of interactive image based session. Interactive image based session. Are you ready, guys? How is the Josh, my dear students? How is the Josh in forensic class, Menak Datta and others? Yes, guys, come on, tell me, come on. You ready? Ready for the image based question? 10 questions are there. 10 important image based question or 10 important short answers. Yadushin is telling, yes, sir, bahut badhiya. Manak Datta, excellent, excellent Manak Datta. Srimati Shivkumar. The first question I'm going to tell you, this is the 3 marks question. Now, the history is, this is the history of murder. Okay, history of murder, unknown dead body hai. During crime scene visit, a 40-year-old male, okay, 40 year, by looking at the dentition, by looking at the sutures and all, age 40 years tha. Male tha, purush, UDR, unnatural death hai. Skeleton was found. But examination of the skull, during postmortem examination, what I found two fractures are there. The fracture segments are depressed into the brain matter. Anyone can identify this fracture. This is suggestive of some heavy weapon is used, which has small striking surface. Like example, hammer. In this particular case, the weapon used was hammer. Skull injury is there. Skull injury. Anyone? What is this? Tanya Sharma. 3 marks question. याद रखना पड़ेगा. Depressed fracture. ये क्या है? Depressed fracture है. इसको बोलते हैं signature fracture. It is caused by hammer. Hammer मतलब heavy weapon. Heavy weapon with a small striking surface. Is punishable under 103 BNS. 103 means murder. So this is 3 marks question. Depressed fracture. Yes, is it clear? Okay. बहुत बढ़िया. So this completes the first question. The first to answer by यदु. ओके, यदु नहीं है इसमें. हाँ, तान्या शर्मा. बेटा तान्या शर्मा, एक्सलेंट आंसर, बहुत बढ़िया, सिंपली एक्सलेंट. नाउ सेकंड क्वेश्चन, वेरी इंटरेस्टिंग क्वेश्चन. A 35-year-old male, partially naked, protective padding was there. Game is over. Simple word I'm telling you. Game is over. The action is over. The game is over. Pleasure is over. Game is over. Anyone? What is this probably? Again, 3 marks question. So 3 marks question here. This is classical auto erotic asphyxia है. मैं क्या लिखना बताओ 3 marks question में? Need to write it is a accidental death. Point number 1 लिखना है accidental death. क्या क्लिनिकल फीचर क्या है? मेल है, सॉलिटरी एक्टिविटी है, मतलब एक्टिविटी विद इन द क्लोज रूम, सॉलिटरी है. सफरिंग फ्रॉम ट्रांसवेस्टिज्म, समटाइम ट्रांसवेस्टिज्म, फेटिकिज्म, previous history of sexual perversion, no history of depression. This is a sexual death, sexual asphyxia in death. 3 marks question. Game is over. Good evening, Sir Ji. Need to explain. That's great. That's great. बहुत बढ़िया हो गया. Game is over, guys. Game is over. Life is over. Game is over. So all of you just type in the chat box. Game is over. तो याद रखना पड़ेगा. Game is over. चलो हो गया. हाँ. Now next question, 3 marks question. 3 marks question is something related to alcohol. Something related to some solid food. So solid food है. Solid food under the influence of alcohol in bar and restaurant. The history is history of sudden death in a bar and restaurant under the influence of alcohol while having some solid food. Sudden death resemble like heart attack. So people said it's a heart attack, clear cut case of heart attack. The blood alcohol level is around 120-200 milligram percentage. Male hai, death in the bar and restaurant, resemble like a heart attack. What is this? 3 marks question. इसको बोलते हैं कैफे करोनरी सिंड्रोम. कैफे करोनरी सिंड्रोम. So the cause of death in cafe coronary syndrome is vasovagal inhibition. It's also known as banana syndrome. So the foreign body which stimulate the recurrent laryngeal nerve, superior laryngeal nerve, vagus nerve, which is inhibitory in the heart, leads to cardiac arrest. Game is over. Cafe coronary syndrome. Remember, in cafe coronary syndrome, signs of asphyxia are absent. Asphyxia signs are almost absent. It is a sudden death. The treatment is CPR. Cafe coronary syndrome, banana syndrome. Good answer. So this can be 3 marks question. Sometime a question can be asked, what is the difference between choking and cafe coronary syndrome? Okay. Cafe coronary and choking. Choking is foreign body occluding internal air passages. The classical signs of CPC are present. Asphyxia signs are very commonly present. But in this banana syndrome, the classical signs are usually absent. The death occurs suddenly. So 2-3 points we can write. Alcohol and death, cafe coronary. Some solid food and death, cough is there, signs of asphyxia is there, Heimlich maneuver is given, choking. Choking answer होगा. ठीक है, बहुत बढ़िया मैंने आंसर. First answer by Rakesh. Rakesh, excellent answer. One of the hard-working student, Rakesh. Good answer, Rakesh. Keep working. Hard work definitely matters in life. Okay, बहुत बढ़िया. Now this is also interesting scenario. The scenario here, death due to walking behind the tractor. So during autopsy examination, the findings are these like this. So this man was standing behind the tractor. So that is basically handle of the tractor. So the dead body was trapped. Its body was trapped between the handle of the tractor and the pole. You can see here clearly visible graze abrasion there. Graze abrasion. Cyanosis present. Petechial hemorrhages are there. Line of redness is there. My question is, what is the probable cause of death? Again, this is the famous question. So this is classical case of traumatic asphyxia. याद रखना पड़ेगा. Traumatic asphyxia. What are the features of traumatic asphyxia? So due to trauma over the chest, the clinical features are deep cyanosis, site of remarcation, there is a clear visibility of demarcation, petechial hemorrhages are very commonly present, and congested organs. It is also known as mask ecchymotica. Mask ecchymotic. Okay. Traumatic asphyxia. Got chest compression and death. Okay. 3 marks again, all of you guys. Try to memorize this. Mixed bag questions too. So not only toxicology, but also some topics on asphyxia as well. Now, this is also a very interesting question. 5th question is very interesting. Identify this sexual perversion. Anyone? Hi? So, this is classical eonism. Try to memorize eonism, transvestism. Okay, sometime question can be asked, what is cisvestism? All are almost similar to the same condition. Okay, transvestism, a male wearing female dress, behaving like a female. Sometimes it is associated with sexual perversion, sometimes it can be sexual asphyxia and transvestism, known as eonism. Inappropriate clothing is known as cisvestism. So 3 marks question can be asked. Menak Datta, Edusen, Tanya Sharma, Srimati Shukmar, very good. Now this is also a very interesting question from Animal movie. You must have seen Animal movie. In this, you can see the 2 findings are there. Look at this, 2 asphyxial death and 2 findings are there basically. The one is constriction of neck in the elbow band and around the eye due to blunt force trauma. There is a finding. Both are 3 marks questions. So this is known as mugging. So what is mugging? Question can be asked. Mugging means constriction of neck in the elbow band and knee band. Point number 1. Mugging means constriction. What are the clinical features? CPC present. Cause of death asphyxia hai. Okay. And this is black eye. Black eye. Question can be asked, anatomical basis of black eye, spectacle hematoma, and it's a type of migratory bruise. Both are 3 marks questions. Black eye and mugging. Yes, it can be choke hold also. Yes, yes, choke hold, carotid sleeper hold also. That is also breath hold also. Okay. What is the cause of death in case of drowning? One more very important question. ड्राउनिंग में मृत्यु का कारण क्या है? वन कैन आंसर. ड्राउनिंग में cause of death है asphyxia, मोस्ट कॉमन है. Sometime laryngeal spasm, vasovagal inhibition are secondary causes, secondary infections. Yeah, this can be 3 marks question. Drowning. Sometime can be asked, what are biochemical abnormalities? Hyperkalemia in fresh water leads to increase potassium, leads to ventricular fibrillation. In case of seawater drowning, is myocardial anoxia. Okay, so good. Secondary infection, that is also correct answer. That's great. Then look at this now. This is also a very interesting question. Here is a case of medical negligence. The patient came with a history of abdominal pain after some surgery. During X-ray examination, during ultrasound, there was a foreign body inside the abdomen. You can see the foreign body inside here. Or some surgical instrument which was found in the body. Definitely medical negligence. The fact speaks for themselves. What is this known as? So this is res ipsa loquitur. याद रखना ये है res ipsa loquitur. मतलब क्या है? Facts speaks for themselves. Famous question. It is applicable to criminal negligence as well as civil negligence. The punishment can be as per 106 BNS, 2 years of imprisonment and also very high compensation as per the consumer court or the civil court. 2-year imprisonment also. Okay? Try to memorize this. 3 marks question. Res ipsa loquitur. The fact speaks for themselves. One more variant is doctrine of common knowledge. So leaving swab, leaving instrument in the abdomen, definitely medical negligence by using doctrine of common knowledge. So surgical instrument is not the content of the abdomen, abdominal cavity. Okay. Yes, good. That's okay. So that is about the 8th question, 3 marks question. And the 9th question, very interesting question here, guys. Very famous movie, Arjun Reddy movie. In this Arjun Reddy movie, some different doctor so enjoying his life in some unethical manner. So doctor practicing unethical manners, unethical things. What is this known as? Is it punishable, not punishable? If punishable, what is the punishment? Anyone? What is this? Arjun Reddy, Kabir Singh. Yeah, okay, do scene. Beta, this is professional misconduct. Prof misconduct, also known as infamous conduct. तो हम बोलते हैं infamous conduct. इसमें क्या क्या इंक्लूडेड है? इसमें इंक्लूडेड है 6A इंक्लूडेड है. A मतलब क्या है? A मतलब अडल्ट्री है, मतलब सेक्सुअल इंटरकोर्स विद द पेशेंट. A मतलब एसोसिएशन है, एसोसिएशन विद अनक्वालिफाइड पर्सन, इसको बोलते हैं कवरिंग. A एडवर्टाइजमेंट है, large signboard. A for alcohol, A for addiction. ठीक है, adultery, association, advertisement, alcohol, addiction. Any other A, guys? Any other A other than this? Adult advertisement, large signboard using some abnormal titles. Okay. Sometime even dichotomy. Dichotomy can be 3 marks question. Please splitting. The punishment is the cancellation of the degree, cancellation of the license permanently. That is known as professional death sentence. So EMRB याद रखना पड़ेगा. EMRB is the board of NMC, which is the appellate authority in case of medical negligence and professional misconduct. Ethics and Medical Registration Board. So A for, yeah, one more A I forgot to write. Abortion. Abortion without indication. 6A disco is the mnemonic. Okay, good. So that's about the 9th question, important 3 marks question. And the last question of the day. Last question is very interesting question. Look at this, a case of blunt force trauma. A case of blunt force trauma, blunt and assault. Assault by blunt force, like iron rod, stone pelting, iron rod, stick, hockey stick, bat. So blunt force. Blunt force injuries are abrasion, bruise and also laceration. So this is a type of bruise which is seen around the eyes, clearly seen around the eyes. See here, blood collection around the eyes because of the firm attachment of occipitofrontalis muscle in the front part. Okay, what is this known as? This is known as migratory bruise, spectacle hematoma, raccoon eye, very good. So intracranial fossa fracture, very good. There can be intracranial fossa fracture, or there may be injury to the forehead. It's basically a raccoon eye. And yaad rakhna, battle sign. That is also 3 marks question. Battle sign. This completes today's session, guys. So all the 10 questions are very commonly asked. So just to revise, first question, 3 marks question, most expected question, signature fracture, depressed fracture, skull is depressed into the cerebral matter and death, hammer. Second, autoerotic asphyxia, it can be main question, clinical scenario, game is over. Third, banana syndrome, cafe coronary syndrome. Fourth, traumatic asphyxia, 3 marks question. Sexual perversion, transvestism, 3 marks question, very common. Then mugging, choking, all this we discussed in the class. So this is mugging, or it can be carotid sleeper hold also. Drowning we discussed in the first class. Then reception locator, facts speaks for themselves. Professional misconduct, battle sign, frequently asked. Try to memorize today's topic, very important topic, that is basically topic of snake bite, very important main question. Then one more topic very commonly asked is your OP poison. OP poison. So this completes today's session. Any doubt you can ask me. Also, any doubt? I'm a very slow, very fast. So forensic is very scoring subject, very interesting subject. So most of the important questions, clinical scenarios we discussed in last 7 classes. We have one more class tomorrow, Toxicology 2. In that session, we are going to discuss about heavy metal poison, one more frequently asked question. Then few points about alcohol, opium, Arjigona mexicana, gastric lovers, about antidotes, chelating agents, and frequently asked question in Datura. Datura is favorite of examiner. Strychnine poison, spinal poison, favorite of examiner. Yes. Okay, tomorrow we are going to discuss Booth Bungalow series questions. Some interesting real case scenarios tomorrow. At the end of the lecture, just remind me. So, yes, Yadushreen and Tanya Sharma. Let's do it tomorrow, Booth Bungalow series. Today we discussed triple death. And this is triple death, I said. Today's class, triple death. With the finding of endogenous burn and also the entry wound. This can be 3 marks question, beta. Entry wound. And song of the day, you just try to memorize Nerium Odorum Cerebra Tivicia. Okay, Tanya Sharma. I hope you will remember this song. Nerium Odorum Cerebra Tivicia. Manak Datta, all the best, Manak Datta. Yadushreen, all the best, thank you. Srimati Shukumar, बहुत बढ़िया.